I'm here with Dr. Lindy from Foot Specialist of Birmingham. If you're dealing with heel pain or plantar fasciitis, one of the biggest questions is what treatment actually works. Today, we're talking about how plantar fasciitis is diagnosed and the different treatment options available. Dr. Lindy, when someone comes into your office with heel pain, what does that first visit usually look like?
Well, the first thing we do is get a history. You got to get a detailed history of what's going on. So you want to find out from the patient, what is the location of this foot pain? Is it in the arch? Is it in the heel? Are you experiencing pain at other places in the foot? Sometimes that's a tip off that there may be some other things that are going on. So a lot of people have heard of plantar fasciitis or heel pain, and they think it's one thing and it's really something else. So you got to get a detailed history. I also want to know what they do in their lives. You know, some people are kicking pipes at a steel mill. Some people are just, at a computer all day. These things make a difference, not only in how you treat it or what effort it's going to take to get them better. So, you want to know how long it's been going on. That can have a factor. What have they tried before? Have they tried just things from the store? Or did this just start up and they're just coming in for the first time? Have they been seen by other physicians before? It's not uncommon. I hear people, they've seen 2 or 3 other people and they just aren't getting better. And then we try and track down what were the treatment plans that were provided before. And then we just want to make sure we're not going to be doing the same thing over and over, hoping to get a different result. So a history is very, very important. And so we spend some time talking about that. The second part of it is really the examination. So we're trying to localize where this pain is. We're moving the joints, the important joints that affect this kind of painful problem, and see if there's any abnormalities or differential kinds of things that can be involved in creating this pain. We can watch them walk and see what their gait cycle is like. So once we have a valid history and physical, we can deduce where we are in the stage of this and then start to apply appropriate treatments.
And why do you focus on solving the problem so quickly?
Well, what we try and do is evaluate whether this is an acute problem or a chronic problem. And usually when it's in an acute phase, if you can be aggressive in treating it, you can get this down pretty quickly and try and manage it. So that's one reason why we try and get this done as fast as possible. Because once we get into a chronic stage, even though there's a lot of conservative care involved, it takes a longer period of time to get better. Some of the techniques might have to be, or you might have to use various methods that aren't or that we wouldn't use in an acute phase of plantar fasciitis. So if you catch it early, it seems to be easier to treat. Once it becomes a chronic situation, we really have to add some other treatment methods in there.
Gotcha. And what are some of the most effective treatment options?
Well, we try and stage our treatments. We start very conservatively, what I would call standards of care. Yes, you can do some stretching, and we try and educate people the proper way to do that. Icing is helpful. Types of shoes, just some basics to evaluate whether people are having, shoes that don't work with them very well. So we start at the very basic level, and then we move up into the treatment methods that might be a little bit more invasive, if you will. Something like a cortisone shot sometimes can be helpful. Change in activities, change in shoes. So these things would also be in play. And if you get into a situation where you're not getting better, and I would add to that a prescription-based orthotic is usually very important, not only in the treatment of plantar fasciitis, but in the prevention of it being a recurring problem. So once you've done these things, if they're not getting better, sometimes you're using other methods that can be invasive or non-invasive that are a little bit more advanced.
Dr. Lindy, what is shockwave therapy or topaz therapy?
Well, there's similar therapies in that they are based on what we call regenerative medicine or immunotherapy, if you will. So if you think of a chronic situation, which plantar fasciitis sometimes is more of a chronic situation, these methods, whether it's shock wave, which sends pulses of energy, shock waves through a device that will, it's non-invasive, kind of, if you will, create a little injury to the area. Basically saying, okay, or telling the body, okay, you have a little injury here. Let's take our immune system and go down there and try and heal it. Okay, so it sees it kind of as a new injury in a way, and then you stimulate your immune system to go down and try and start that process of healing it. Topaz is similar. It's a little bit different. It's usually a minimally invasive type of procedure, and we have a little electrical probe. We numb the heel area up, and then we put this probe down and we put a little series of divots, if you will. A little electrical energy puts these divots in the plantar fascial ligament, and it's usually just confined to the heel area. But the idea is the same. We're creating a little injury, waking up the immune system, having the immune system go down there, and those cells that repair injuries will help to stimulate the healing response. So they're both effective methods. Shockwave has been around probably 25 years now or longer. I was involved in the early stages of shockwave in the late 90s. The machine was the size of a VW Bug at the time. Now they're handheld, but there's been a lot of studies. It's commonly used in Europe. It's used in the United States, but it does have some problems with insurance coverage. So that does have some effect on whether people can get that treatment or not. Topaz is done typically in an outpatient center, mostly because you have to numb the entire heel, and that's a little uncomfortable in the office. So it's really only a 10-minute procedure. It's not a technically difficult thing, but it's the same kind of thing. Once we get these divots in the plantar fascial ligament, we're waking up that immune system to go down and heal it.
So earlier you said that if it is a chronic pain, that essentially your brain sort of shuts off your immune system. Is that how that? Is that how you're explaining that?
No, basically, usually when you have a problem, an injury, your immune system is going down there to heal it. And many times you don't even know it. But it has a cycle. And the immune system cycle is about a 3-month period. So, you can have this for a few months and your immune system may be trying to go down there and heal it. And it may be that the mechanics or the activities you're doing are not really allowing it to heal up entirely. So that immune system kind of goes through that cycle and you don't get better. And that's when I consider it falling into a chronic stage. And either you're going to treat it through other methods that us doctors go through to try and take the pressure off the ligament or get it healed up. Or sometimes we try this immunotherapy where we restart the immune system, whether it's a shockwave therapy or whether it's a topaz therapy. But I don't think you look at those therapies in isolation. You're usually using it with other things. So you're starting that immune system by doing these therapies, but then you're trying to still affect the mechanics of the foot, whether they are prescription orthotics or whatnot, because you still want to alter the mechanics that cause the problem to begin with.
I'm here with Dr. Lindy from Foot Specialist of Birmingham. One of the most common concerns people have about treating plantar fasciitis is whether the treatment will be painful. Dr. Lindy, when people come in for treatment, what are they usually worried about? And what does the treatment feel like?
Well, people generally don't like going to the doctor, and they don't like going to the doctor because the number one concern is it going to hurt? So I understand that coming in. So you have to understand that people are fearful just coming into the doctor's office. And I don't think anyone's immune from that. I'm a physician. I don't like going to the doctor all that much, but you have to do it sometimes. And so in terms of treatment, most of the treatment for plantar fasciitis is not an uncomfortable endeavor. It's really, there's a lot of conservative therapies that are not uncomfortable at all. And probably the only thing that I really see that's of any kind of level of discomfort would be a steroid injection. And so people have heard about it. They're nervous about it. I understand that. But there is definitely a certain way to give these type of injections. And in my office, I think it's critical that we use ultrasonic guidance because I want to be in a very specific place. I don't want to be in the fat pad of the heel, and I don't want to be necessarily directly in that plantar fascial ligament, because when you push on the plunger of the syringe, the force can actually have little tears to the ligament if you're inside of the ligament. So you don't want to mechanically irritate that area. So there's a sweet spot there. If you get to that spot and you can see it and you can give the injection the correct way, you can minimize the discomfort. But most of that discomfort is not from the needle. It's from the medicine. There's a little numbing medicine in there, and that can have a little sting to it. So there's a little discomfort. I've not had any dramatic problems, but yes, there's a little stinging that's involved. But I think there is definitely a way to do it to minimize discomfort. But other than that, the majority of treatment options for plantar fasciitis are really not painful endeavors.
And so what do patients usually expect during recovery?
Well, I think patients expect that the next day they wake up and that it's going to be gone. They've gone to this doctor and the magic wand has been waved and it's all over, and I'm going to go and run trails at Red Mountain or something this weekend. It doesn't really work that way with plantar fasciitis. To me, treating plantar fasciitis is a two-prong approach. Yes, plantar fasciitis is an inflammation of this ligament, and it takes some time for that inflammation to subside, although it can be rapidly reduced with a steroid injection. But usually that gets the pain down significantly, but not all the way. From that point, the more important treatment aspects of it has to do with support and stability. That has to do with shoes. It has to do with activities. And in our case, we really kind of specialize in prescription-based orthotics to control the mechanics of the foot. So it's usually a pretty dramatic decrease in pain within a week, but it's not fully gone. And then from there, we're controlling the mechanics, and it can take either several weeks or sometimes a couple months to fully resolve. But it's just a matter of finding the right techniques to get that patient along as quickly as possible.
Gotcha. And can you talk about how much treatment typically costs?
Well, treatment costs are variable, and a lot of it these days has to do with insurance coverage, which can be very tricky. Just because you have health insurance doesn't mean all things are covered. And nowadays, many people are realizing that the deductible levels are very high, or the co-insurance percentage that a patient has to pay are very high. So that does sometimes have an effect on the treatments that we can do. And we do like to have a discussion with our patients. We do try and evaluate their insurance to the best of our ability, get that information from their insurance company and see and let the patient know in advance what those expenses will be. Sometimes it's very limited amount of expense depending on their insurance. Sometimes it can be quite expensive, but we never know, and everybody's insurance is varied. There are some treatment options that are really not covered by insurance, things like shockwave therapy. There are also some newer therapies which are like placental stem cells that have a lot of promise, and we're starting to see a lot of studies come out, and we're excited about some of these things. There's also other therapies that aren't covered. Sometimes something like there's a method called platelet-rich plasma, in which they withdraw some blood, they spin that blood, they take platelets from it, and then they re-inject it. And that's been around a while now. I don't do a lot of that. I find that the results can be variable sometimes, and also it's a little bit uncomfortable. So and it can be expensive sometimes. So Some treatments are covered really well, depending on what one's insurance is like. Sometimes it can be a little bit more expensive. Sometimes the orthotics that we use are covered completely. Sometimes they're not covered at all. So we just try and inform our patients before we take the liberty of just running off and treating them.
Why can treating it properly early actually save money?
Well, you're trying to reduce the progression that you go through care. So, like I said, we start very conservatively, and that's usually very inexpensive. But and we work our way up the treatment options for plantar fasciitis. But typically, the higher up you go in the treatment options, and the longer it takes to heal, it becomes much more expensive, or can become more expensive. And there are times that we go through all the conservative options, and sometimes we're left with having to do a procedure. Sometimes we do actually have to go in and do a small release to this ligament as an end stage when conservative therapy fails. And those work, but it's a very, very small amount of people that ever need to have that typically done.